Good afternoon, everyone. Good afternoon, everyone. Okay. It's quite dark where you are. It's nice to get a sense of the life behind the chairs. Welcome to this session that will be focused on tackling tomorrow's health challenges today. My name is Tallulah Oni. I'm a clinical professor of global public health and sustainable urban development at the University of Cambridge. And I have the easy task today of moderating this wonderful, wonderful people. We're focused on tackling tomorrow's health challenges, and I want to, over the course of the next hour, just deconstruct that a little bit. So we will be exploring what those health challenges are, but critically, I want to place an emphasis on the tackling. So it's all well and good to anticipate and understand what those are, but that has to be informing action, and it has to be doing that in an inclusive and all-encompassing way. So I will be challenging the panelists, but also you as the audience to come at it with a sense of bringing your perspective, but also focus on solutions and focusing on how we tackle these challenges. I don't want to say much more because I want to make sure we leave some time for questioning and for discussion and some questioning. I will firstly introduce the panelists and then we'll get going. So in order of seating, we have Tan Cho Chuan, who is the Chief Health Scientist at the Ministry of Health, the Executive Director of the Ministry of Health Office for Healthcare Transformation of Singapore. We have Ryan Morhard, who is the Senior Director for Policy and Partnerships at Ginkgo Bioworks in the USA. We have Mubin Ghulam, who's a stem cell researcher at the Department of Human Biology and Neuroscience Institute at the University of Cape Town, South Africa. And we have Mariam Ez El Arab, who is the International Genetically Engineered Machines Competition Ambassador for Africa and the winner of the 2023 GESDA Youth and Anticipation Initiative from Egypt. So welcome.
Welcome.
And congratulations.
Thank you.
Okay, Cho Chuan, we can start with you because you are placed very much in the center of things from a government perspective. From your perspective, why is this? Can you just set the scene a little bit on why this is important and how you're seeing these tomorrow's health challenges playing out at a country level for you?
Yeah, thanks. Good afternoon. And word anticipation encompasses expecting things that are to come and taking action beforehand. And from a health system point of view, if I take the perspective of a policymaker, we do need innovations. We do need innovations with most healthcare systems moving towards population health and preventative health, towards more value-based outcomes and greater health equity. So those are the goals of most healthcare systems. And for many countries around the world, healthy longevity is also a key part of what we need for the future. And therefore, we do need the innovations that will allow us to do this more efficiently and cost-effectively. So the anticipation part is very important because it allows us really to look at science and technology around the world and to see where potential solutions might come. But we also do know that there are negative and unintended consequences associated with innovation. And our goal as policymakers is to try to maximize the benefits and try to reduce the downsides. But what are some of the challenges that we have? I would just name a few. The first is that most policymakers are not well attuned to the rapidly changing science landscape. And it's hard enough to follow the science and then to understand what the potential implications might be. If we take the COVID example, when vaccines became available, I think many policymakers were not really prepared for the disinformation, the vaccine resistance, the unwillingness of population to take vaccines. So being able to look at the potential solutions for the future and setting out some of the risks associated with them is an important part of bringing on board policymakers to be better able to shape this. And the final thing I will say is, once we have done the anticipation, what do we do with this set of potential solutions and possible downsides? I would say that watchful monitoring is very critical at the policy point of view, and taking a calibrated response, because we do want innovation, but we want to try to prevent the downsides from manifesting. And therefore, engagement of policymakers, of professionals, of advisory groups, and of the public is very critical, with the caveat that most health systems have a very busy agenda. And it's not really possible to keep on introducing new things to the population and asking them, what do you think about this or that? I mean, it just is not very practical. And therefore, quite often we do a concentric circle, and depending on the proximity of the issues to public interest, that is often the point where we do a much broader public consultation. For many other things, we keep a watchful eye, engaging professionals and advisory committees. But I'll stop there. But this will be really from a policymaker's perspective.
Okay, thank you, Cho Chuan. I'm going to cede a question to you that I will come back to. See, I'm very nice, I give you heads up. So if, this topic is addressing or tackling tomorrow's challenges, health challenges today, from some of the issues that you've identified in Singapore, if we do a little bit of a post-mortem of today's health challenges, what should we have been doing yesterday, right? So if you can think about a challenge that you're facing today, if you had an anticipation approach, what should we have done yesterday to tackle that challenge today? So I'll come back to you on that. So I'll move on to you, Ryan, because you are really at the coalface of looking at some of the different trends that we're starting to see in terms of these new and emerging health challenges. Can you tell us, because you're working in synthetic biology, can you share with us some of the trends that we're starting to see, but also how you see diplomatic processes as potentially well-positioned to confront those trends?
Yeah, absolutely. And first, so it's an honor to be here, and really happy to be on the panel and to have the chance to share. I think to answer that question around the tools and the trends, I actually might pick up on this post-mortem idea, because if you think back a little bit to the way we've anticipated in the past, right? And one of the areas where we spent a lot of time doing that actually as a community was around pandemic preparedness. And then, of course, we've all lived through a response now. So there's kind of the data points there to reflect on how did we anticipate and so on. And particularly when it comes to the tools of biotechnology. And so one way to do that is to look at, two pandemics kind of next to each other. And so there's 2009 H1N1 pandemic response, and then there's 2019 or so, right, COVID response. And there's 10 years in between those responses. And when we think about the tools of biotechnology that were associated with kind of navigating through the pandemic, like think about through COVID, like we had, of course, the vaccine, and then we have, of course, large-scale biosurveillance. So we do variant tracking. So we're kind of doing sequencing. We're reading the DNA of the COVID virus to figure out, like, okay, is this Omicron, is this Delta, or what it is? Okay. Those are the tools of biotechnology that helped us navigate the COVID response. Okay, in 2009 H1N1, we saw around the world 350 million vaccines deployed around the world. A global response in 2009 H1N1, 350 million vaccines. And when it comes to sequencing, the reading of the DNA, in the US alone, we saw 10,000 genomes sequenced in the United States. Okay, that's 2009. 10 years later, but basically also 10 years of kind of neglect to preparedness later, frankly, we saw in the COVID response over 13 billion COVID vaccines deployed. And in terms of sequences, 16 million sequences have been shared in the public database. So we're talking about 10,000 to 16 million on sequencing, and 350 million doses to 13.5 billion doses of vaccine. Okay, and I know they're different responses. There's a lot that's different, but that's incredible, sort of dramatic improvement in the sort of application of tools of biotechnology to solve a problem that we're facing. And so I share that to kind of highlight the difficulty, I think, around anticipating, right? And it does, of course, create challenges, particularly around, we discussed around vaccine hesitancy and so on, but it also can potentially create massive opportunity. And actually today, we sit at the cusp of kind of being the first generation of our species that can actually say we can apply the tools of technology that we've invented to actually remove pandemic risk kind of from the table. That's a possibility that is before us that is kind of really new. And so there's a challenge there. And in fact, when we think about anticipating, like no one was anticipating that. Like no one in 2018, if you would have said, well, how many doses are we going to have? No one would have ever said, we're probably going to have 14 billion doses in a couple of years. And so anyway, and by the way, that's, and it's not to overlook the incredible inequities and so on and difficulties around distribution and things like this, but it is to highlight the cumulative number of vaccines, and there's something like 70% of people have received one. So, okay, the tools there that made this sort of innovation, this leap forward possible, are also tools that now we're seeing, with the potential to transform other big challenges that we're facing. Right? Those same biotech tools are also seeing applications in food security. I know Miriam may say more around that. This has been the winning submission for her project, but in food security, but also in agriculture, and of course in materials and in chemical production and things like this. All the way we make things, and of course the way we treat disease. And so I think really, I'm really excited for this conference and this community to sort of bridge that gap between these tools and how we can apply them, and to think, what would we do if we were to have the same kind of transformation in the tools that we have at our disposal? How should we think about that, and how should we think about making sure we apply them against the big challenges that we face today? And that's what I'm excited to discuss. Thank you.
Thank you. That's really interesting. 13 billion doses deployed, I think, as you say, is mind-blowing. The one thing I would come back to you, and one thing that struck me about what you're saying is, to what extent are we limited by our inability to imagine? And what is the role of how we do science and how we govern. So what is the role of academic institutions, and what is the role of governance institutions and mechanisms to really spur and nurture that imagination? Because if we can't imagine, that could be, then we don't aim for it. So I'll come back to you on that. But I think this is a good point to bring in Mubin, because you're establishing the first brain organoids lab in Africa, so never been developed previously from cells of an African origin, which is incredible given the genetic diversity of within African populations, and thinking about what implications that that can have for therapeutics and diagnostics, etc. But why are you the first? Why are you the first?
Thanks very much, Julia. So I think that's sort of part of the problem, and the reason that I studied overseas and then I came back to South Africa, my home, to establish this brain organoid, which we take stem cells and we can culture them in such clever ways that they start to form the structures of the human brain, which are incredible for disease modeling and drug development. And it's because there is this global inequality in diversity. We're talking about healthcare technologies and the incredible things that they've done. And I'm glad you brought up the code of vaccines, because I have a point to make about that. But it's equitable access. So I intentionally went to a place that didn't have a technology to try and bring it there, because diversity of opinions and genetic diversity in the models that we generate, or the way we make inclusive models, or the way that we generate new ideas. So we had a really nice workshop in this idea space across the road at CERN. And one of the ways it's structured, there's a big, huge 1960s London bust in the center to try to disrupt the space to make you generate new ideas. And one of the ways we do that is having inclusive places. And so that was the sort of thing that's been, I don't want health technology to perpetuate, is the global inequality between a global north and a global south. And as we have new technologies, it tends to increase the healthcare gap between the north and the south. So the modern advanced forms of healthcare are only accessible in specific nations and specific parts of those nations, particularly, and Africa tends to get left behind. So as we talk about developments and the way we generate them, we also have to talk about the policies to make sure that they are equitably accessed and equitably spread across the world, that everyone has a right to healthcare and right to these modern technologies and their placement. Because if there's no policies in place and we don't anticipate what those policies are and how they're going to affect others, then we can have dangerous situations where, like in the COVID vaccine example, so in both timing and in pricing, there was a stark difference between what the global north had compared to the global south. So African nations and the African Union had to try and get access as well as Africa did it individually. But we got our access to vaccines significantly after other countries. Anecdotally, my colleagues in the UK had their second doses, frontline workers had all been double dosed, as well as children and those who weren't at risk of COVID before nurses and doctors in African countries had even seen a vaccine. So it was an inequitable spread, but significantly worse than that, there was the vaccine contracts that South Africa held with the different companies across the world were declassified. And what we saw quite shockingly was that compared to the European Union's prices, the biotech companies had charged between 15 to 30 to 150% more for South Africa per dose than they were charged here in Europe. So one vaccine was about $2 per dose, and South Africa we were charged $5.6 for the exact same doses. So, and we are a country with significantly lower GDP than the nations in the north. And that was a real issue of access. So many South Africans weren't able to get access to vaccines, weren't able to get enough in sufficient time. And that Big Pharma's priority there wasn't to bring a deadly pandemic under control, it was to maximize its bottom line. So guidance and regulation in access to technologies, even though the response to COVID was incredible, there was difficulty with the way it was managed in that regard that I would like to see developed. Yeah, I think I'll stop there for now.
Okay, so I'm going to challenge you in terms of if you could reconceptualize global health governance, right, in terms of institutions, and maybe the post-mortem is the theme here. What do you think would be needed? What could either existing organizations have done differently, or do we need new global health governance organizations? What do you think the issues are on that to tackle this critical issue that you've identified around equity? So, Mariam, I'll come to you. So, you know, we've talked about your winning entry was around deploying some of these incredible tools to not even tomorrow's challenges, today's challenges, actually, of food security. Now, I recall that when I was kind of reflecting on these, on this session, two Lancet commissions came to mind. One was the Lancet Commission for Adolescent Health in 2016 that identified that some of the issues with adolescents and youth need to be empowered to contribute to designing policies and systems that contribute to their health. Because when we talk about tomorrow's health challenges, the people who are kind of adults and older adults tomorrow are not part of shaping those policies and systems today. And then the other commission that came to mind was this was in Brian, help me out. 21, thank you. The Lancet Governing Health Futures Commission came out that identified a need to focus on digital solutions and then bringing in this kind of inclusive populations, different inclusive perspectives. But interestingly, one of the things I liked about it was also identify that digital solutions are not just about healthcare and treatment, but also a need to focus on long-term prevention and developing frameworks for meaningful youth engagement to develop these interventions. So digital is just an example of kind of these new technologies that are being developed. Can you share with us your perspective, so coming from your background and how you ended up proposing food security and what you think, needs to be done to better get voices like yours into how we're shaping systems and policies?
Okay, thank you so much. And let me take a moment first to thank GESDA for being here, and I'm really honored and thrilled to be here. At the very beginning, how I thought about the proposal is I saw two trends. One is negative and the other is positive. I thought about climate change and its effects on agriculture and farming and everything, and how it's getting worse in the following years. At the same time, I saw another positive trend, which is the alternative ways for agriculture and farming, creating food in the lab, like plant-based food, dairy-free milk, vegan shrimps. All of these are like rising technologies that is really impressive. And I thought as the challenges of climate change is increasing, now we have also the technology to face those challenges. So what is really special and impressive about using synthetic biology in farming and creating meat and creating food in the lab is you can control a lot of factors. You are avoiding foodborne diseases. You are avoiding items and elements you don't want. You are also having a controlled environment, so you are not affected by the climate change, the weather, the insects, the pests. So it's a very controlled environment that can produce a better quality food. And at the same time, you are not considering if this season is too hot or too cold, if there is storms or not. So I saw this technology as something that can really give us an opportunity to thrive in climate change and in all the environmental changes we are facing and will be facing in the next years. So this is how I thought about the idea. And I thought, of course, this will have impact on avoiding foodborne diseases, avoiding malnutrition in some places if they are no longer able to do the agriculture or the farming, because a lot of diseases spread more in specific climate or for example, in Egypt, I believe 2 years ago, because of climate change, there were specific microbes that was transferred into the farms, and a lot of cows was not cannot be used anymore. So this affects the dairy products, the meat, everything. Yeah.
Oh, that's really interesting. That's interesting. So the question I'll come back to you on, Mariam, is that, I always say I don't actually like to use the word youth in the African context because, we think about youth as a niche group usually, and people like to pat ourselves on the back, it's like, oh, look, here's a youth perspective. But when you're from a continent where 3/4 of people are classified as youth,
yeah.
If you're not talking to youth, I'm not sure who you've been speaking to, right? So in the context of being the majority demographic, what do you think needs to be done better to get that majority perspective into how we're shaping policies and systems to better future-proof our health in that way? So come back to you on that. Okay, let's do another loop. Take notes of your questions because we're making good time, and we'll definitely come to you for questions. So, Chochuan,
Yes. So I studied your exam question.
Yeah.
And I would say I like to choose the example of the application of digital technology to promoting population health. In Singapore, we have a health promotion board, and it's very active in running National Steps Challenge, run for several years now. Participants are given a step tracker, and then they receive monetary and other rewards for achieving a certain number of steps every day. And we were very excited by this idea, and we've been implementing it quite large scale. Many of the seasons when we run this project, we get several 100,000, occasionally 1 million people signing on. So this was a fantastic program, but I think we learned a few very important lessons in retrospect. The first is that we did not reach the people who probably would have benefited most from it, because quite often these programs don't reach out to the hard to reach. Typically people who are somewhat from low income backgrounds, less educated, 2 jobs, and they are probably the ones who would benefit most from this. And the program did not actually reach out to them. And so what we learned, particularly from this example and from the COVID example of vaccinations, is you have to have a very deliberate and intensive effort to engage the people who are hard to reach if you really want to get good outcomes. Because in most health systems, it's that 20% of harder to reach that drive many of the poor outcomes for the whole health system. So that was a very important lesson, and I think it applies more broadly to many of the innovations that we look at. We get very excited by them. We get very excited by the technology, but we then have to reduce it into something that can be implemented on the ground that would cover the people who would most benefit from them. And that extra design step takes a lot of specific effort, but I think if you really want to drive population health, you would need to do that. I'll just end by saying parenthetically that in Singapore, several 100,000, maybe 300,000-400,000 people don't use handphones. Typically, older people who grew up at a time when Singapore was a much less developed country. And so even in a country where, if you visit, looks very modern, there are a significant proportion of people who are not digitally connected, and we should always bear this in mind. That's what we constantly remind ourselves.
Yeah, so that's a really excellent point, and that kind of deliberate efforts to reach people who would benefit the most. And that starts right from asking the question, even framing what the question is, what you're trying to address, because sometimes we have the solution, right? And we say, what do you think is the best way of addressing this? But then
so
they say, well, that's not my problem.
When we do our sort of assessment of the risk of exacerbating health disparities, it should be one of them.
Right.
Because quite often it's not on the list, and therefore just unconsciously we miss out on doing it.
Yeah. So deliberate reach out and metrics matter, and who's defining the metrics, absolutely. Ryan, how can we imagine better?
I was hoping you forgot your question.
No.
No, I've been thinking deeply about it. So the question was, how can we imagine better? And probably the things that we imagine is kind of a product of the tools that we have at our disposal, and then who's using them, probably. And then so I think I can only just speak to biotechnology, but I think what we're seeing in biotechnology now and over the past several years, kind of a convergence of trends, what you're seeing is this combination of automation and data science and AI and other technologies together with traditional biotechnology that is actually changing the way we use biotechnology. And one way to think about this is, most of us probably associate biotechnology with pharma applications. Okay, so why is that? Well, because actually, even though pharma is very much biological, there's nothing uniquely biological about pharmaceuticals, right? Our whole biology made us, biology makes our atmosphere, it makes all of our food, and so everything around us is very much biological. Even the fossil fuels that we use for our energy and for the petrochemicals that make our materials and other ingredients and so on, inputs, fossil fuels are really just old biology, right? That's just old plants and microbes that have sat there for a long time. So everything's biological, not just pharma, but why is it that we associate it with pharma? Well, it's one is because it's powering amazing breakthroughs in pharma, so that's interesting. But two, pharma is pretty expensive to do historically, right? And so if you're going to do biotech, historically, it's been like, okay, well, like, it's going to be someone pipetting, and it's going to be a big lab, and it's going to be expensive equipment, and it's going to be full of risk. And it's going to be, so you're going to be taking expensive risks. So where can you justify that kind of commercial investment? Well, okay, you have some ROI in pharma. You can make your money back in pharma. And that's where we've seen it. Okay, these tools are all coming together now, plus accumulation of experience that is allowing us to reduce those risks in biotech and also broaden the way we use the data. So we can start to see biotech applications in other places, and certainly Miriam has spoken to a few in climate tech and in ag and in food. And so that's super exciting that we're broadening the application space, also broadening the user base. Isn't it exciting if you can get engaged in biotech without having a PhD? Like we all in this room, many of us are using computers. I don't know how many of us actually know how to program a computer, right? Maybe some do, but I don't, and I use a computer every day for stuff. And so that's when you start to get really imaginative around how you can use something, and that's why I think actually my kids, so I have an 8-year-old and a 5-year-old, I think when they're sitting in a room anticipating science and diplomacy, when they're a little older, they will be kind of associating biotech with climate tech and manufacturing tech broadly. And that's what's coming for them. And I think that's really exciting, and that's sort of the way we anticipate things. And I think we would be well served if that's kind of how we started thinking now and how we started to kind of speak with policymakers and so on. So yeah.
I mean, you think they'll be associated with climate tech. Actually, you don't know. Right.
There's a lot I don't know about what my kids are going to do in 30 years.
Because it's interesting, and it's interesting you mentioned your kids, because element of play, and this is such a fundamental aspect of our cognitive development as human beings. And then over time we remove that and we kind of silo. Yesterday at dinner we were talking about serious play, and the role of kind of bringing play back into sparking imagination. So actually bridging these silos, and this is the kind of potential for science diplomacy, right? Bridging this. Yeah.
Can I just say a very quick thing on play, because I think it's so important, because like so many the creativity is such a driver of actually doing things, and I'm the least creative person in this room probably, but I can recognize the value, right? But one thing we're seeing, there's a very interesting company out there that is called Light Bio, and they're making these light up petunias. This is bioluminescent petunias, right? And these are flowers that light up, through their metabolic processes. They're lighting up. That is, I don't know the practical use for that. I guess it would be nice to light up your walkway and things like this, and it would, but it is playful and it is amazing to see, and it invites your imagination, and when we look at them, it is inspiring. And it leads to there are other kind of practical applications that you could think of based on being inspired by that idea. But that kind of playful application of biotechnology would have been completely, speaking of anticipation, completely unforeseeable 10 or 15 years ago. Yeah.
Mubin, do we need play then in governance?
I think certainly it helps, and sort of I was thinking about on the creative aspect. One of the ways you also generate creativity is by trying to diversify your opinions and the people giving you opinions. And it's quite interesting you mentioned about policymakers not chatting to scientists. Some are scientists that I've never had. We sort of silo ourselves. We're the ones creating the research, and the policymakers are making the policies on the research, but we never talk to each other, which is why events like this and putting policymakers and scientists together in a room together to discuss things, and people who are at different stages, I think is interesting. What I like about this panel in particular today is that we're quite diverse in where we are and what we're doing, and our ages, and where we are in our processes of what we are making. So I was scientist. I'm quite a solutions-based person, and I was thinking a bit about sort of the way you address the problems I was speaking about earlier, and I think the ways to look at what has been successful in the developing world, where we are the world leaders, and one of the areas that we really have been able to be world leaders because of it's not predatory partnerships, there's not predatory relationships and collaborations, is infectious disease research. Is truly a global thing. We like saying global, and sometimes when we use the word global in the Northern Hemisphere, we tend to mean it includes America and Europe, whereas global needs to be more diverse and include Latin and South America and Africa in those conversations, so you're not truly being global. So infectious disease research, Africa is an absolute leader in that, and one of the reasons, I'm glad we have a lot of members of the Wellcome here, because Wellcome invested not only in individual researchers in Africa, but in massive centers across the continent, and developed over time. I know we keep saying capacity building in Africa, but capacity in those areas have been built that attracted the world leaders to those places. So if you were talking about HIV research or malaria or TB, truly the place you can go are the institutes of infectious diseases dotted around Africa, where the work they're doing is equally as impressive and equally as important and shared with those in the global north. So that's the strategy to approach things with, is to use the same model system where we have these infectious disease issues located in Africa, tropical diseases and infectious diseases like HIV and TB and Zika, and we shared the partnerships equilaterally, where it was not just you have a global north partner to try and get you somewhere if you're from Africa, which too often happens in other fields. It was, we are equal partners in this, and we've developed incredible technologies along the way in both sides of the world. I think that's the way that we approach other healthcare technologies, is the kind of collaborations that we need to talk about.
So the building of the institutions to sort of the center of gravity is you have multiple centers of gravity.
Exactly, that's a beautiful way to put it.
Yeah, great, thank you. Mariam.
Hi.
Tell me before you answer that question, are you involved in any spaces of kind of decision making or policy or systems now?
No, currently
Okay.
I wish.
Right. So now answer your question.
Okay. So to answer your question, I see like there are two tracks that may be the solution to have more youth. The first is like enabling them to be in policy making decision positions, and in the government to listen to them, in organizations to like include them, especially as you said, it's majority of youth. So how come the majority is not deciding what's happening in our country or in our region? So, but I also want to highlight that it's more important to have the youth also prepared for this. Sometimes we feel like we are too young for this. We are too young to take a decision. We are too young to speak about this. So I think this also something inside that should be like trained and be prepared for that. And let me reflect on my experience in IGEM. I'm a little bit biased towards IGEM, so I talk about IGEM a lot. But when I participated as senior student in my Faculty of Science, I participated in IGEM. One of the things that was really new to me, that science not only takes place in the lab, you have to go outside, you have to do some human practices, you have to ask people. We already engaged with a lot of policymakers. It was the first time to do that. We didn't know before that this is an option. It's something we can do when we are above 40 or something. So yeah, it was like, we were given the encouragement to go and to speak to them about the technology we want to implement, because they need to know about it. If it's only developed in the lab, it will never be in the market one day. So yeah, I also want to take the chance to encourage the youth to take the step. Yeah, someone may help you to do the decision, but you can also go and discover and explore yourself.
And it's interesting that you mentioned iGEM there, because what that demonstrates to me a little bit is the power of the collective, right? And having, yes, you want to go and do that, but to be able to be connected to other like-minded and to motivate and mobilize each other.
Yes, exactly.
Getting that peer support is absolutely critical. Fantastic.
Thank you.
People, what did you think? Questions, comments? I want a young person first. Not to bias, I can't quite see you, but anyone who self-identifies as being young? Yes, there we go.
Here we go.
Hi, my name is Kalonji, and I'm one of the youth cohorts as well. I think the question will come from the conversation I was having with Mariam earlier yesterday when we met. When it comes to, let's say, the product that are being made like in the lab and all of that. My background is in molecular biology. I'm a final year PhD student. And sometimes it starts with the conversation that we have, even with our friends, just around the table. When you tell them that there's this company or there's this firm that makes meat, for instance, in the lab, and all of a sudden everyone just goes quiet as you're trying to explain to them the benefits that it will carry. And sometimes also what we don't learn as scientists and young scientists is how can we make it easier for the community that we're trying to help to break down that information in such a way that they will also get to accept. Because sometimes we spend most of our time in the lab preparing for all those very cool ideas, but if the people that we want to help, they're not able to receive, then it's also quite a huge problem. Yeah.
So how can we better, I'm going to take another question from that side of the room and from a woman, but how can we better communicate some of these things, and what can we better do? Who would like to?
Hi, everyone. Thank you for an amazing panel. Thank you so much. I think thinking about the reason for this panel, tackling what is coming, I work in the health sector, and the health sector is about to be burdened even further. And that's why also we need innovation, because it can accelerate and maybe decrease a little bit the burden of what it's up and going to happen, right? But it is the inequity factor also, it makes it even more complicated. And at the same time, innovation also costs a lot of money. And we have our health systems today, and we have something that we say in our team, that we say we actually have a disease system and not a health system, because we are much more locked into treatment and not into prevention. So when you have a very high resilient system like this, locking us all into systems that treat diseases instead of prevent, it is even a harder thing to do, because we will have to dismantle the system in the way it is now and slowly push to another steady state, right? A state that then I think we will be able to call it health system, because it will be prevention. So it's just a curiosity, because it's a bit of an exercise as well. What are the feedback loops, or maybe the reserves, or maybe the processes that we need to start putting in place now, so we accelerate and push the system to prevention? I have a few ideas, but it would be lovely to hear what you think.
Great.
Thank you.
All right. Then we'll take one more free, wild question. From anyone? One more question?
Yeah.
Okay, over here.
There's a hand at the back.
We've got two.
Sorry, I'm in the dark, so you cannot see me tall.
Oh, sorry.
This is Marga from World Solar from GESDA. A question for Ryan. When we met in China a few months ago, we discussed how can we make multilateral diplomacy more anticipatory. And you gave some examples of science that gets outdated by the time diplomatic agreements are reached, because the length, the timeline of the diplomatic process doesn't match the fast pace of science every day getting more fast-paced, right? Can you give some example? I think the pandemic treaty, WHO, is one that you mentioned based on vaccine scarcity, which is no longer the burden that we're going to have in the next pandemic if it comes. So maybe Ryan and also, well, any of you, but Ryan, that's based on something that I know you think about a lot. Thank you.
Okay, I'm going to break my rule and ask and get that last question, and then we'll go around to the over here. Thank you.
I want to pick up, sorry, my name is Dennis. I'm a Member of Parliament in Ireland, and I'm chairperson of the Interparliamentary Union Working Group on Science and Technology, where we're trying to build a relationship between science and parliaments, trying to develop evidence-based decision-making. And I was taken by the point that was asked about disease systems versus health systems. Mubin was mentioning the issue about diversity of opinion, which I think is critically important in all of this debate. And Miriam mentioned and touched on the decision makers, because the politicians are the decision makers. And while we have plenty of debate about policy and policy makers, we don't really engage with the decision makers. And coming back to the example of the health systems is a good example, because in Ireland, we turned our health system on its head, where we actually asked the politicians to plan out for the next 10 years how our health service should be delivered. And they actually turned around the whole approach, rather than looking at disease, to actually focus on prevention. Because the politicians have to look at that, because they have to try and deliver on it. And the point I'm trying to make here is, we can talk with the policymakers, and the scientists can talk with the policymakers, but if they ignore the decision makers, we're going to lead to the time lag in terms of the delivery and the implementation of this. And Miriam's example, I think, is a very innovative example. But I, as a Member of Parliament, the first question I would ask is, well, what happens to the farmers? And unless you can answer that question, it's going to be a barrier to implementing what is a very innovative solution. So I think diversity of opinion also means that you need to talk to the public, and the best way to talk to the public is their representatives, and bring them into the conversation. Thank you.
Thank you for raising that point, because it reminds me of another interesting experiment in that space around decision-making in actually Wales, around thinking about the Future Generations Act, right? And then looking at actually institutionalizing an aspect of the government that is somebody that's responsible for thinking about the future generations unborn, and looking at the impact of whatever decisions have been made on that generation. So if we do that for health, it would be a very different subject. So thank you very much for highlighting that. Okay, so we have 4 different questions around how do we better communicate, what do we need, around shifting, how do we anticipate not just the solutions, but actually the systems needed to shift into more health-creating systems as opposed to disease systems. The multilateral aspect, so how can we kind of bring that in, and engaging better with decision makers specifically. So in no particular order, who would like to jump in?
Yeah, thanks. Great questions. Maybe I can just speak to the questions on the shift of the health systems towards much more population health, and how to do this in a sustainable manner. I perhaps can just reference some of the things we're thinking about in Singapore, and make 3 points. The first is, I think we need to go beyond the health system to a much more whole-of-government, whole-of-society approach, by which I mean, if we really want to drive prevention, it's really about physical activity, eating, mental health, and cessation of smoking. I mean, those 4 things account for maybe about 60% or 40% of the premature mortality. And the best way to do that actually is not really to get individuals to change their behavior, but to change the environment. So you can, if you design your neighborhoods to be more walkable, if you improve the food environment so that there are healthier choices, if you are able to drive smoking down to a particularly low level, it becomes the norm not to smoke. And therefore, these are things which actually can be done outside the health system, and probably have a much larger aggregate impact together with what the health system is doing. Second point I wanted to make was taking a life course approach. And in Singapore, we started looking really at -9 months to +6 years as the critical period where interventions, evidence-based interventions would potentially have the best impact on trying to rebase the trajectory for disease in the future. So just an example, by the time an average Singaporean child goes to primary school, 6 years old, 20% of them have myopia. And we do know there are preventative things like spend an hour out in the open every day. That substantially cuts myopia risk. But it only works best, the effect size is best when you don't have myopia. And so therefore, if you start in school, it's already too late. And there are many other things that have their roots in early exposure. And therefore, if you really want to intervene, that would be the time to go. And the third point really is on aging, which again is a major driver of utilization of hospitals and costs. And I'll just maybe speak to one part of that, which is that prevention is still very important, even amongst older people. There was a study published that compared 92 age-related diseases across 160 over countries. And what it showed was that in Japan, a 76-year-old had the same burden of that 92 health-related, age-related diseases as a global average 65-year-old. And Singapore is just after that, about 76 years old too. It sort of suggests that even as you get older, it's not inevitable that you accumulate a lot of chronic diseases. And therefore, even for older populations, prevention is really critical. Now, how to do this within a health system that's already very overloaded? I think it's really about prioritization. And many of the efforts can take place in the community, utilizing community resources. And where there are technologies that can help us to do that, they can be very helpful. And those technologies need not be targeted at individuals. For example, if you use AI to improve the walkability of a neighborhood, that can actually help improve the environment for large numbers of people and not single individuals. Thanks.
Thank you. Ryan, do you want to take the multilateral?
Yeah, happy to. And also may speak to a couple other questions that came up too, but very briefly. I think in fact, I'll start with the kitchen table conversation around plant-based meats and cultured meat and things like this, and basically food technology. But of course, I'll thank you for the multilateralism question. So I think about that conversation a little bit, and actually, it also gets to your question, Dennis, about the farmers and displacement too. It's like we should have a pretty clear understanding about why we're doing something, and right. And so, like, I think about that. You mentioned a kitchen table conversation around, hey, I'm going to do some biotech for plant-based meats or biotech for. I think someone would say, well, why would you do that? Right? Like, that's a good, fine question, and I think and that's why this project, Miriam was like, well, foodborne disease or well, climate. Like, well, it would be nice to be able to have an independent food supply that we don't have to be importing. And like, there's lots of reasons, but unless you give the reasons, then nobody has a basis to evaluate why that's worth doing or interesting at all. Right? And I think that speaks to this kind of like. Like we spend a lot of time in this kind of science and diplomacy conversation around like, hey, it would be nice if the politicians and policymakers knew what was going on in science. Sure, but it would also be nice if in the science community we knew how government worked and things like that too. And, right? But this is a two-way street, but the way government tends to work, if I could suggest, is they start with a problem. And usually it's an urgent problem, right? So what is the problem that we're trying to solve, right? And then you can kind of bring the solution against that problem on the right timeline. And then that's when you gets interesting. And that's where, to kind of wrap up on the multilateralism point, that timeline is kind of way out of whack. You're right. Multilateralism is one of the more important things that we could be pursuing, I would suggest, as a kind of a global community these days. But the process is so asynchronous relative to the innovation climate around the technologies and the science that by the time that tedious agreement is reached, at much political expense and opportunity cost, et cetera, I'm afraid that too many of them are out of date, which is insidious in a way, because then it leads someone to question the value of the process at all, which is, I think, the real harm.
Yeah.
Yeah.
Thank you. So being able to articulate why something is necessary is critical, but one of the things I took from the last point was also being able to articulate, if you like, the good faith reason why you shouldn't do it, right? So what are the costs, what are the other things, the unintended consequences that decision makers have to consider that maybe you haven't thought about? So we rarely ask ourselves that. What is a good idea? What's a good faith argument against that? Can you argue that? So can you just riff on that a little bit around that decision making and being able to, our ability as scientists to not be, yes, we're laser focused, but we also have to be able to see more broadly in order to engage.
I think it's interesting that Ryan said about partitions start with what is the problem, because that's actually how we started in the science field together. But the problem is I'm in that room and you're in that room. So I think the real simple solution is things like this. We now have policymakers, decision makers, and scientists together talking about problems and talking about solutions that we can combine together. So more inclusive events where every one of those types of people are involved. And there aren't many of them really globally. There aren't that type of forums where we get together. So those kind of spaces need to be more apparent and invite more different perspectives from different people into them. And this, I was thinking about, I think brilliantly answered about how you turn a disease system into a health system. And I was thinking anticipation forward, because we are really, a lot of countries are banning smoking from a certain age and really pushing that very well. So if we are anticipation summit and looking towards the future, the thing we aren't banning or looking at really, it's going to be as bad a problem when we find out how bad it is vaping is suddenly all the rage, and it's going to be replacing smoking amongst the youth because there aren't any policies that limit it, isn't viewed in the same as tobacco, but the effects it has on your lungs are horrific. So as an anticipatory unit, that's the kind of problem that we should also be thinking about, I think, and single-use plastics that you throw away and discard. Additionally, there's a solution that needs policies now to try and get ahead of until it turns into something like smoking.
Yeah. Mariam, you're young, you're a woman, you're African. If there's anyone that embodies the future and tomorrow in the 3-in-1, I think is you. What do you think?
Hard question. Okay, I think let's take it from a positive and optimistic view. I think this is an era where is the best time to be an African and woman and a scientist. Yes. So, yeah, I think I cannot deny that I gain support from a lot of places I've joined, like IGEM, my work, everything, like it's supporting and helping to do more and to like reach good positions. Yeah, so yes. I have nothing to say.
Incredible. No, I think the thing you keep repeating there is that kind of connection and that support and how we're ensuring we're nurturing that pipeline. Two things jump out at me from this discussion, and they're diverse and deliberate. If we want to tackle tomorrow's health challenges today, we have to think in diverse ways, whether that is from the sectors that we engage with, the opinions that we engage. We have to be deliberate in the efforts in who we reach and who we're engaging with, how we're preparing a pipeline and supporting a pipeline, but really how we're experimenting with different technologies, with different tools, different systems, different processes, different governance mechanisms, different institutions. And I think bringing all of that together, the future is bright. I mean, I think you end up in a. We've ended this this session in a fantastic way. So, please join me in thanking all of these fantastic panelists.
Thank you.
And thank you.